En mi intervención quería, en primer lugar, darles a todos la bienvenida a la Facultad de Medicina y Odontología de Santiago, de un modo más especial a aquellos que nos visitan por primera vez o que nos visitan menos, para que lo hagan.
So they may come more often from now on. We have endeavored, summer starts today, and apparently it's the we've been suffering from the longest winter since 1947. So I cannot remember how the winter of 47 was. This one was longer, and we are prepared. We have prepared. We are prepared so that you can enjoy the city of Santiago now that the summer has started. This is the School of Medicine that is 366 years old now, and it has a school of odontology that is much younger. And it ranks #1 in research of all the odontology schools. It's a special pleasure for me as a professor of preventive medicine and public health to welcome you to address this topic that is so important, that's the early detection of oral cancer. I won't compare this to rabies, because there has been a case of rabies in Toledo. And beware of rabies and its conditions. Of course, let's not be a bit dramatic, but there could be some comparison to oral cancer, or mouth cancer, actually. I like this term better, says the speaker. If it is not early, it does not have an early diagnosis, then it'll be too late. This morning I had the opportunity to visit some illustrious professors that are with us. Professor Varna Sakur, sorry, we can't pronounce it, from London. Professor Rapidis, also London. Professor Michel Mignona from Naples. And Dr. Connor McAllister, who has just addressed the audience. I agree. Well, I'm a doctor, not a dentist. I agree that with what the president said, but I disagree with the fact that he says that he's a politician. He's not a politician. He's a professional who is doing a good job of professional policy, not politics, because politicians in Spain are not very much loved in this day and age. However, that's not the case for dentists. It is true that the number of students that we train in our schools must be adapted, on the one hand, to social demand. That's a logical thing. This school here in Santiago, medicine and dentistry, we have the two degrees that have the greatest demand within the entire university system of Galicia. The highest grade is for medicine, and the next highest grade when accessing university is for dentistry. Obviously, families want their children to get proper education, but we have to bear in mind too that it's the best students in high school, in other words, the best of students, and if we're going to engage in a course that will lead us to frustration because there are no job opportunities, the example of law is very much used, but a lawyer or a degree in, someone with a degree in law or someone with a degree in philosophy or a degree in history or a degree in economy may find other jobs. Such graduates may do many different things. The graduate in philosophy is not prepared to work, is prepared to know and to learn about the world. However, a graduate in medicine, a doctor of medicine, a dentist, can do nothing else than be doctors or dentists. So if they cannot practice their profession, they will become frustrated. With regards to doctors, for some years now, there's a clear imbalance. At one point, we had less supply of doctors, and then we had many immigrants. Some 40 to 50,000 doctors migrated to Spain in a short period of time. And we're training too many doctors compared to the number of vacancies in the public health system. If you cannot do your internship in the public health system, then you cannot practice a profession. This is like being in a no man's land. It is certainly a problem. It is a problem that we face. And with regards to medicine, we have to strike a balance and adjust the number of doctors that we graduate with, at least the numbers of vacancies in the public health system internship. And eventually they would find a job. Today we cannot think only in terms of Spain. We have to broaden our horizons and think of the European Union or even the whole wide world. And it's still an important problem. Another problem, if the President allows me, I won't address very deeply, is that of specialization, in which there are different positions. I think it would be important to develop all the specializations also within dentistry. I think this is a subject pending, but it must be developed. And from the viewpoint of organizing teaching, it's also a problem for us that there's no such specialization among the teacher bodies either. I won't say much more. I don't wish to take any more of your time. You have to start your work. I would like to congratulate the organizers of the course, Dr. Juan Sioani, who is the director of the stomatology department. It ranks first in Spain as a research center. But also Dr. Andrade, who has coordinated this campaign. The School of Medicine and Dentistry of Santiago is very honored to welcome you this year. But we would be even more honored if this event were to become institutionalized and you could come and visit us periodically to address this issue. And I would like to also thank the proposal by Dr. McAllister for the 17th of September to be declared the European Day against mouth cancer. And this would be a conclusion from this Santiago meeting that I hope is very fruitful, not only in what regards the science, but also that you may get lost in the alleys and streets of this old city and enjoy our wonderful food and the hospitality of our people. I hope you have a very pleasant stay here in Santiago de Compostela and at the School of Medicine that is at your disposal. Thank you very much.
Buenas tardes a todos.
Good afternoon. So this is the risk factors that can favor the appearance of oral cancer. we, particularly those who have their private office, have to help many people to discover some lesions, some injuries, some problems that may appear, and which, if we don't take into account, may lead to an oral cancer with terrible consequences. So I would like to tell you first of all about those risk factors which we have to know and understand, and then I would like to finish my speech by saying a few words about what the General Council of Dentists in Spain is doing so that we can do something to avoid the impact of this disease and to help reduce the number of, well, the incidents. Oral cancer is a serious problem worldwide. Mortality is high. It causes disfiguration by treatment. It's quite sort of mutilating, a functional deterioration of the person that suffers this cancer as well, changes in behavior, economic, sociological problems. And we have to take into account that every year in male patients there are more or less 12 to 15 cases per year, 2 to 4 female cases per year as well. It's quite a relatively high incidence, which we have to take into account when we try and help reduce the effects of this cancer. We have to take into account that although therapeutical methods and the treatments that are provided are more and more advanced every day, the spike of this mortality is still quite high. This is basically due to the fact that diagnosis is usually given at a late stage when the disease is quite advanced and it is difficult to stop it. It's usually 3-4 stages, 3-4, and with a bad prognosis. We all have to take into account that detecting a small lesion, maybe a pre-cancer lesion or an on-site cancer, that could be of help to try and avoid further problems, and it could have good consequences in terms of the treatment that we could offer to the patient. Here you see some information about the fact that head and neck cancer is the 6th human cancer that typically appears. 3% of all cancers are located in the oral cavity. And we diagnose 575,000 cases of oral cancer new per year. 50% of those cancers are diagnosed in people above 40 years of age, and more than 50% in individuals above 65. We've recently detected a high incidence in younger patients, which could be related to an incidence of the human papilloma virus. We will talk about this later on because it is a factor that's having a great influence in the appearance of oral cancer during the past few days. We've all heard about oropharyngeal cancer that was related to sexual contact. We've heard about this, but this could be related to this human papilloma virus as well. With regard to histology, 90% of these carcinomas are oral carcinomas. Survival at 5 years is 40-56%, more or less, although it varies. In lip cancer, survival is slightly higher because palliative surgery tends to be better. In other locations, the figure remains at 30%. This is a statistics that was performed in the United Kingdom, and it shows cases compared to age, male cases and female cases. We see what we saw before as well here. This other slide shows that in the south of Europe, there are 7.5 male patients in comparison to 2.3 female patients. One of the highest countries in the ranking is Spain, as we saw before. Only Hungary is above Spain, although this goes back to 2009. But, well, the idea is that we have to help decrease these data. The lower we are, the better. In terms of the role that a dentist, an odontologist can play, at clinic level, well, we could talk about 3 types of prevention. Primary prevention, first of all, that would involve changing the habits of that person to decrease risk factors and to make it more difficult for this kind of cancer to appear. We should try and promote that that person stops smoking, reduces the amount of alcohol he or she takes, improves its diet. We will later on look at this in more detail. And also, we should try and avoid any kind of problem related to the human papilloma virus. Secondary prevention would take place when the cancer is on site, starting to appear. The most important thing here would be an early diagnosis so that the treatment is positive and with a not very impacting surgery. Tertiary prevention, we're talking about a person who's already gone through a cancer, has been treated, and what we have to do is try and cover for recidivism or secondary effects or things that typically appear in this kind of patients. Also, these patients should be helped when we're talking about complications related to the treatment they have gone through because of their cancer. If we talk about early diagnosis, well, what is this all about? First of all, the idea is to diagnose the cancer at an early stage, a small precancerous lesion, a leukoplasia, whatever, and to see as well if there's a small on-site carcinoma. Sometimes with an incisional biopsy, this can disappear and the disease can be healed. Also, delay times should be reduced. When we detect something in a patient, we have to act as quickly as possible. We shouldn't let much time go by since we detect it until the health system does something about it. Removing risk factors like tobacco and alcohol, this is also of importance, and also offering less dangerous treatments with higher survival rates. There's always a delay when we try to diagnose something or when we see a patient and detect a possible pre-cancer lesion, incipient, whatever. That could mean something. Well, from the moment the cancer appears until you've treated the patient, there are some delay or décalage times. One is a very high importance, which is the case of when we have a patient, we detect something that may seem weird. Well, until the moment that from the moment that the patient detects that until he or she comes to see us, there is a time that goes by. Then the patient comes to us and asks about that problem, maybe to us, maybe to a health center. There's a scheduling delay as well. What happens? Because why has that patient not been sent to a specialist? There's some delay there, once again, which does not depend on the patient, but it does depend on the national health system. And then from the first consultation until the patient receives the adequate treatment, there's a further delay because and this is more related to the national health system and to the therapeutical delay since we diagnose until the patient is intervened, whatever. That waiting period, that delay time, that increases all over the time. The first delay, that has to do with the patient taking a while to go to the doctor. Well, it's important to prepare campaigns to raise people's awareness. If they detect a lesion, if they come to us and show it to us, we can diagnose it. And that can help those patients improve more easily and quickly. Then the other delay, since they ask for a visit to a doctor until they are received by the doctor, that depends on the national health system, and we have to do something about improving all these delays. If we talk about what happens to the patient, well, obviously the patient doesn't know anything about the possible malignancy that small spot in his mouth may be. And also, patients don't know how to self-explore themselves. The General Council of Dentists offers in its website some self-exploration videos available for everybody, for any possible patient, so that they can have a look at that and learn how to examine their mouth, under the tongue, reach some areas which could be of help for them to discover small lesions, whatever, small spots, small things that could take them to the doctor to ask about whether there is any problem about that. With regard to professionals seeing patients, we have to take into account several aspects here. Very frequently, particularly if we're talking about dentists, first, they never think that a patient is going to have this kind of lesion, and then they don't see it. And also, frequently, there's a sort of comorbidity. Perhaps we think about, well, we see this patient and we look at the molar area, the possibility of establishing an implant here, because we think that's more important, and we don't look under the tongue to see if there's any other further lesions. So very important as well in our campaign to raise the awareness of our professionals. One of the ideas of the campaign is to train dentists as well, to show them that what they have to look for. We have to take into account that many dentists, normal odontologists, don't have a hospital practice or a university practice. They only work in their private offices, and they don't usually are very much in contact with this kind of lesions. But anything we can show people with this campaign is or will be more than welcome, obviously. Moving to risk factors more specifically. Oral cancer etiology, well, there are many actors or agents which we could mention. Altogether, they end up favoring the appearance of this kind of disease. One of the most important factors, the one that has more influence, is tobacco. Anything that derives from Nicotiana plant leaves is one of the highest risk factors all over the world for cancer. They have more than 60 carcinogenic agents, aromatic hydrocarbons, amines, aldehydes, metals, arsenic, lead. So tobacco is our worst enemy in this sense. The biggest and strongest risk factor. It contributes to pre-malignant lesions, to development of oral cancer, etc. 75 to 80% of oral cancer cases are related to tobacco. And 70% probably of these cases affect men, 55% women, and they are caused by tobacco. Tobacco has an impact, well, it depends on the amount of tobacco that a patient smokes and the period during which that person is a smoker. Any smoker has 2 to 3 more possibilities of suffering from an oral cancer. So it's dosage and time. The initial dosage to suffer from a cancer would be smoking more than 20 cigarettes per day for more than 20 years and having started to smoke before 15 years of age. Any person in this situation has many possibilities of suffering this kind of cancer. Discontinuing smoking, well, if you stop smoking, it decreases the risks, but it seems that at least 20 years should go by before we reduce the risk of suffering a cancer. And also, tobacco has a lot of influence in passive smokers, and in this kind of tobacco varieties that we are offered in airlines, etc., tobaccos that are nicotine derivatives and which are part of chewing gums, etc., and which are being used more and more frequently in Nordic countries, the United States, Canada, not so frequently in Spain, but we can estimate that there's a high percentage of people all over the world using these products already, and that increases the possibility of having a cancer quite a lot. Also, for pipe smokers or other kind of smokers, there seems to be more possibilities of developing a cancer. Some tobaccos that are typically smoked in India, etc., they seem to be more cancerogenous, and also what we call black tobacco tends to be worse than other kind of tobaccos. These are the worst agents included in tobacco: N-nitrous nornicotine, aromatic hydrocarbons, polycyclic, etc. You can see them all in the slide. What happens is that nicotine is also an important protector for our vessels, which leads to a decrease of gingival microcirculation, the synthesis of collagen, etc. Some people who, for example, have some problems with some aspects, well, this nicotine reduces collagen synthesis and some other aspects, which is of great importance. This also, when we talk about nuclear premorphals, well, this leads to an increase, or this leads to a reduce of protease activity, the generation of hydrogen peroxide and superoxide. And, well, you see everything that can happen with tobacco. It also leads to an increase of subgingival temperature, which produces a series of actions, which is not very positive for the condition of the vocal mucosa, etc. So it decreases our defenses, increases tissue degeneration, and leads to the appearance of carcinogenic agents, which is even worse if this is combined with alcohol consumption and other carcinogenic agents. Today in Spain, we estimate that there are more than 26% smokers, 3.7% only smoke occasionally, 20.4% are ex-smokers, and below 50% are non-smokers. 31% smoke on a daily basis for male people, and in the case of women, it's 21.3% of daily smokers. When we stop smoking, What we've seen is that after 12 hours, there's no coloring at dental level, but until nearly a year, we don't see the disappearance of that cancer development risk. If we look at what the National Statistics Institute tells us, we see that even at university level, we have a lot of smokers. It depends on age as well. But you see data here about the amount of people who are smokers and some of the data, also alcohol consumption related to it. And this leads us to the second risk factor, although dubious, which is alcohol. It's not very clear whether alcohol is a carcinogenic factor per se. If we combine it with tobacco, it is. You smoke a lot and you drink a lot, obviously you have a lot of possibilities of developing an oral cancer. There have recently been some publications which say that in many cases of oral cancer, 37% for men, 17% for women, there is an incidence of alcohol, but it's not clear whether this is the single factor causing that cancer. What happens is that alcohol has a caustic effect. It leads to more oral mucous permeability and favors the access of other carcinogenic agents like tobacco or any other. So it favors the transfer from one layer of our mucus to another and then favors the appearance of cancer. It seems to be related as well to the fact that although oxidation usually takes place at liver level, there's also some oxidation which takes place at other levels, and that could lead to some carcinogenic agents. We also have to take into account that the action of alcohol at liver level favors the activation of other carcinogenic agents which will not be properly purified by the liver and then lead to the appearance of cancer. So basically it causes a release of the epithelium, some ulcers at mucous level, gingivitis, some other kinds of lesions and injuries which may make it easier for some carcinogenic factors to act more quickly and to cause a cancer. A great smoker and alcohol drinker has probably 35 times more possibilities of suffering a cancer than any other patient. Let's not forget that it's not only tobacco without smoke, it's cigarettes, it's machine tobacco, it's chewing tobacco, etc. These statistics shows the risk of suffering a cancer related to alcohol and consumption and tobacco. You see the data, depending on the amount of alcohol we drink and the amount of cigarettes we smoke. And it seems as well that the alcohol consumption is related not only to the grams of alcohol, what is related more to alcohol grams than to the type of alcohol. Here you see the equation. Alcohol grams is equal to cc volume times graduation times 0.8 divided into 100. So you see some examples for beer, for example, which would lead to 13.20 grams of intake. In relation to this, there are some studies which say that 25 grams per day of alcohol, 2-3 beers basically, this seems to increase a lot the risk of suffering a cancer. 50 grams, 3 times more than if you don't drink alcohol, 100 grams, 6 times. And also if we add up being a smoker and a drinker, we could talk about 35 more times. If we look at one of the most recent studies at a European level, well, in Spain, we usually drink 9.9 liters of pure alcohol per year per person. It's quite a lot, obviously. But France is above us, and Portugal even above us, the United Kingdom slightly below, and Germany above us. We've seen also that in countries like France, where alcohol was more typically consumed, more liters per year per person, well, we see a decrease now in alcohol consumption and also a decrease in the incidence of oral cancer. So let's take this into account, and let's not forget it. There's some polemics as well about the possible negative effect of some of the oral preparations which may lead to a further incidence of oral cancer. Let's not forget that many of them contain alcohol, some of the mouthwashes that we use. So this is something to bear in mind. But there seems to be a study published last year by Professor Bagan who seems to find no coincidence or no relation between the amount of mouthwash intake and the possibility of having a higher cancer incidence. Still, let's take this into account. And let's look at nutrition and diet now. We have to know here that there are some elements which help us reduce the incidence of oral cancer. You've been handed out a book which contains some recipes where some ingredients are used. The idea is to use nutrition to favor or to reduce our possibilities of developing an oral cancer. Fruits, vegetables, greens basically have an antioxidant effect. They have a lot of diet, fiber, carotenoids, C, E vitamin, and selenium as well. They also have some other components which help us decrease the possibility of this type of cancer appearing. It is estimated that an 80-gram daily intake, 5 times per day, for example, of, fruits and vegetables, this could help us reduce our risk of suffering an oral cancer, according to a recent study, by up to 50%. One intake per day, one daily doses, also helps us decrease this possibility by 9% at least. It is estimated that 57% of men suffering from oral cancer and 54% of women suffering this cancer, it's estimated that they ate less than those 5 pieces of fruit, vegetables, whatever, that we typically recommend per day. Also for strong smokers and drinkers, it seems that eating this kind of products helps them reduce the possibility of developing this cancer, particularly things like fruits, citric fruits or red fruits, etc. Why is this so? Well, they have an antioxidant effect, an anti-mutagenic effect at cell level, and an anti-proliferative effect. So it's red fruits, citric fruits, greens, vegetables, which are rich in carotenoids, fish and green tea as well. When we talk about red fruits, we refer to berries, basically, this kind of fruits you see in the slide, which contain many components which help reduce carcinogenic cells, which also lead to more apoptosis and differentiation of cancerogenous cells. Citrus fruits, like, for example, oranges or lemon or grapefruit, they also have a lot of flavonoids, which have an anti-inflammatory action, etc., etc. Greens, vegetables, tomato, some kinds of pumpkin and some kind of beetroot as well, they release a lot of vitamin A and lycopene, and they inhibit the proliferation of cancerogenous cells in a doses-dependent manner. You see the data as well for fish as well, and for green tea. And this is very important to show to our patients, because if we help them improve their diet and nutrition, we could be improving their possibilities of suffering less oral cancers or reducing risk factors. So here you see all the data: berries, citrus fruits, greens, vegetables, fatty fish, and some elements with more vitamin A, C, and E. Some nutritional elements which increase the risk, well, meat and raw meat, some kinds of peppers, like chili pepper, for example, very hot foodstuffs, red meats, smoked foodstuffs, etc. Sun exhibition, this is also of importance, and it helps, it contributes to the development of cancer, particularly in people with low pigmentation level. Many people working in rural areas, for example, are more exposed to sun rays, and this leads to a quicker aging of their skin, which favors what we call actinic cheilitis and labial cancer, etc. There were some recommendations years ago for this kind of people to, for example, have a beard, etc., so that they could protect their skin better. Well, this must be taken into account. Some references as well to some other kind of professions where there's more exhibition to the sun. Some people working in the textile area, printing houses, or people working with, for example, in the alcohol business, working with clocks and watches, and also the less favored classes as well. Genetics is also of importance. It seems that for somebody with a genetic predisposition, it's more easily that they develop any kind of cancer. Also, people with AIDS or VIH positive, also some people who've gone through an organ transplant situation, those that are taking immunosuppressors as well, for example, to avoid a transplant rejection, etc., or others that are subject to any immunosuppressor treatment that can favor the appearance of this kind of cancer. The human papillomavirus, well, it seems that it's been proven that there are two phenotypes, 16 and 18, which increase the risk of an oral cancer appearing. This has been acknowledged by the International Agency of Oral Cancer Research, and it seems that in countries like the United Kingdom, where there's 8% of oral cancer cases and 14% of oropharyngeal cases, they are related, these amounts, to this virus. It seems that it typically appears more frequently in women with other anogenital cancer, and particularly with the practice of oral sex, because there's a sexual transmission which favors the appearance of this cancer. It seems to be more negative in people with more promiscuity and where they start having sexual relations at a younger age. In this sense, we could think that the famous vaccine that is now mentioned, there are different kinds of vaccines for this papillomavirus. Well, it seems that there's some mention to the possibility that they could help prevent oral cancer. Well, if we have people with the presence of this virus, not only women but men, it seems that since many cases these viruses are symptomatic, they may have big reservoirs, so maybe if the vaccine were used in a more generalized way, we could see some decrease at percentual levels. It could be. Another risk factor, obviously, cancer lesions. It doesn't matter which one we're talking about. Erythroplasia, actinic cheilitis, flat lichen, whatever, submucous fibrosis. When they appear, obviously, the important thing is to detect them and to advise our patient so that we can do something about it and we can avoid the appearance of cancer. Obviously, if somebody's had a previous oral cancer, that person has 30 times more possibilities of having a second cancer appearance. Even 20 or 10 years afterwards, they still have more possibilities. So we have many risk factors. Many of them are related, well, things that have to do with mouth diseases. There are many possibilities there, but the important thing is that we do as much as we can to reduce that, to help our patients and to give them proper advice so that they can have a good nutrition and diet, they can explore themselves, they can easily detect any kind of lesions so that we can avoid that development. The General Council of Dentists, in this sense, particularly during the past few years, has always tried to prepare campaigns to raise people's awareness about this. We're trying to help both patients to have more knowledge about this kind of lesions and also dentists so that they can find them and diagnose them as easily as possible. So it's training for both groups of people. There have been many training sessions. In fact, in this picture, you see many of the people that are now participating in this meeting, many of them involved in that training, people who, well, I've included myself as well because I also took part in some of the campaigns to try and raise people's awareness. The idea is that we help people avoid the appearance of this cancer. What do we do then? Well, we inform general population, dentists as well, pharmacists as well, chemists, so that they know everything about it. We have to take into account as well provincial associations, different kinds of dentists associations, so that everybody at local level tries to help and contribute something so that this is disseminated as broadly as possible. The mass media also is very important. I think that a press conference can be useful, anything that can help us inform people in general, dentists as well, but people in general, that anything of that way can help us reduce the incidence of this kind of disease. So we've prepared several kinds of campaigns, always using the different associations that exist in Spain, always offering press conferences. Normally one is done in Madrid generally, but then afterwards we also ask the regional and local associations to organize more press conferences, and so that everything is as broadly disseminated as possible. Sometimes in these campaigns, we may not receive many patients, but people understand that that may appear. And in fact, I always receive more patients after a campaigning period. They remember what they were told. They keep that in mind because they watched it in the news, whatever. They heard it in the radio. They read it in the papers. So they have that idea of, well, the possibilities of preventing if they do something about it in time. Well, for these campaigns, we prepare different kinds of leaflets. We distribute them throughout Spain. We present them to the media. And in fact, in some of the most recent campaigns for patients, what we did is for 15 days, well, perhaps it should be done in a more longer basis, but well, what we've tried is that, for example, if a dentist sees a patient and detects a possible lesion, the idea is that he or she can send this patient to the specialist right away without him having to go through a primary health center where maybe the receptionist receiving the patient doesn't know anything about this, etc. A general practitioner may see this case, but well, maybe they don't know anything about whether that white spot may be a problem or not. So the idea is that everything is done as accurately as possible. Well, this obviously is also then published in our journals, in newspapers, by means of leaflets, so that it reaches all possible target audiences. The first big campaign took place in 2007, another one in 2009, where there was a possibility of seeing patients on the 26th of October, 6th of November 2009. You see how we're trying to attract people's attention, and then in 2011 a new campaign took place. In between, there was some dissemination of leaflets, also some oral cancer courses were offered as training for dentists, and when all these brochures, etc., were disseminated in between so that as much information is available as possible, and so that through this free campaign we can inform people and help reduce the risks of this disease. This is an example of what you can access at the Council's webpage. You can see, for example, how an exploration can be done. This is available to any dentist or to any patient. A dentist, have a look at this. Some maybe leave the university and they don't know exactly how to look at some parts of the mouth, so it's interesting to be able to have a look at this. We've had the help of some famous people, like Mayra Gomez-Kemp, for example, who helped us. She wanted to actually speak. She had suffered from an oral cancer, and she came to us and joined us and recorded this video for us. Also, you have here the reference to that book with 54 recipes to prevent oral cancer that you were distributed. This is also of great importance, I think. And another book on self-exploration, which I think was quite successful. Some pictures, recipes. Well, you have the book with you, so you can have a look at it in detail. And well, basically, the idea is that we've done as much as we could, distributed those books. We have offered a CD to all members of the association explaining them many things about this. Also, diplomas were available to participants in the courses so that we promote the idea that they should take part in this training. But well, despite all this, response is not as good as we would like it to be. Explorations are done. We ask dentists to join us in training sessions. We offer them a diploma so that they can exhibit it in the private clinics, whatever. But well, the result is that although participation was about 2,000, 3,000 dentists per campaign from 2007 to 2011, this is no more than 10% of the dentists we have in Spain. It's something for free. It could be of help for any dentist. It could even help them have more patients, receive more patients in their clinics, but in their practices. But still, it's not a lot. We have to keep on working on this. Our annual budget can be up to 30,000 euros, but we've always spent even less than that. So
Si
We
bien
have
en
to do something
2009
about this.
tuvimos
In
115.000
2009, we had
visitas en la página
nearly
web, en
115,000
la
visits
campaña
to
de
our website.
2011
This is one
se ha
of the
llegado
most
casi a las
important ways to
200.000,
distribute information about what we
con una
want to
descarga del
show.
libro,
You see
visita
the
al
rate of
libro de las
2011,
recetas de casi 62.000 y cerca de 3.000
1,054,000.
descargas del libro.
Many people downloading the books that
Yo
we
creo que
showed
son
you
cosas
before. And well, I think
que
that this
ayudan
dissemination
a
material
pensar
in
en
our
esta
website can be
enfermedad
of help. It helps
y a
us
que nuestros
think
dentistas,
about this
nuestros compañeros,
disease. It helps our
dado que es tan
colleague
importante y
dentists as
toda
well
la
think
cantidad de
about this
gente que
and
lo
learn
puede
about
sufrir,
it. This is very
ayudar
important.
que entre
It's a
todos
type of cancer that can be suffered by
favorezcamos
anybody.
el
The
que
idea is that
España baje de ese
altogether
segundo puesto en el
we
nivel
should
del sur de Europa.
favor or
Una
increase the
cosa muy
possibilities
importante
for
que se está
Spain to
haciendo
come down
también es
from
conseguir
position
una
number
serie
2
de
in that
convenios
ranking
en
that we
distintas
saw
provincias
before.
y comunidades.
We're
Por ahora
also
lo
trying to
tiene
sign
el
some
País
agreements in
Vasco, lo
different
tiene
regions and
Aragón,
locations. Up till now,
lo
we've
tiene en
signed it
algunos
with
sitios, en
the
Andalucía lo
Basque
tenemos muy
Country,
avanzado,
Aragon, in
y
some
es
parts of
conseguir
Andalusia as well. The idea is to sign
que
some agreements
cuando una persona,
so
un
that
dentista le
when
detecta
somebody
algo,
goes to a dentist
pueda ir
and the dentist
directamente
detects
al
something,
especialista
that
mandado por el
person
dentista de
can
la
go
calle. O sea, que no
straight
tenga que
away to the
mandarlo a un centro de
specialist,
salud y
referred by
prorrogar esa
the
demora.
dentist. The idea is that
Es
he or
difícil
she, the
convencer a la
patient, should
administración
not go
pública para
through
este
the
tipo de
general
cosas,
practitioner
pero
first to obtain
vamos a ver si poco
authorization
a
to visit
poco
the
lo vamos
specialist.
consiguiendo
It's something that's moving on slowly,
y
but well,
ponemos nuestro
we
pequeño
see
granito de arena
what happens.
para
It's
intentar
just a
promover la
little
salud, que
bit
es
of
una de
help,
nuestras misiones principales,
something
y
something
favorecer
else to
que esta
contribute to the
enfermedad
promotion of
disminuya lo
public
más posible.
health and to make
Me he
this
atrevido a
disease
poneros
diminish
una
as
foto de
much
la
as
Catedral de
possible.
Jaén, no es la de Santiago,
Well,
desde luego, pero
this is a picture of the
también
Cathedral of
tiene su
Jaén.
mérito.
It's not that of Santiago, but well, still it's a nice one. So I thought it would be interesting to show it to you.